Today I'm going to walk you through how to perform a disease inspection in your hive for any honeybee brood diseases. Before we get into our hive, we need to put on our personal protective clothing. I have a veil, some people wear half suits, some people wear full suits, strong boots, preferably with steel caps, and gloves. Some beekeepers wear gloves, such as dishwashing, leather or nitrile gloves. My personal preference is to not wear gloves because I can wash and decontaminate my hands more easily between hives. Everyone is different, every beekeeper is different, this is just how I do things. So along with your personal protective equipment, you do want your smoker and your hive tool. And we also, because we're doing a disease inspection, we do want some type of jar to store our sample in and some matchsticks. Beekeepers should always be carrying matchsticks in their pockets if they come across anything suspicious. So what you do is you pull the matchstick out, find your suspect cell, put the matchstick in, twirl it around and pull it out slowly. You'll then put the matchstick in the sample jar and seal it. Now we want to get into the hive, give that a bit of a smoke to calm the bees down. So we're going to take the lid off, place the lid on the ground. We want to get down into our brood box to perform our inspection. Remember, always bend your knees when you're lifting a heavy honey super off. We're going to get into the hive now. A bit more smoke so they stay calm. We want to take our queen excluder off, inspecting the bottom part for the queen, making sure she's not on there. Just going to lay that on there next to me. Now every beekeeper is different. Some beekeepers like to go to the middle of a brood box and pull a frame out, and that's okay. The way I like to do it is go to the side and push the frames across and then pull the side frame out. The reason for this is so I don't roll my queen. So I'm just looking for the queen. I'm not going to go through all the frames to find her, but this one is going onto the ground there, onto the side, and so I don't want her to crawl off. So we're going to shake the bees off. A couple of good swift shakes, and then I'll place the frame gently on the ground so I have a bit more space to work here. And then oftentimes the brood will be in the middle, especially during winter time. So I'm just going to go 2 frames in, pull them to the side, and pull out my first frame to inspect. And very gentle. Quick glance for the queen, because I will be shaking the bees off of this one too. It's not important to find the queen, but if you would like to find her and capture her and keep her safe for your disease inspection, you can do so. Couple of good shakes. So we have our first frame. To get a clear view of the brood, position the frame in good natural light with the sun behind you. This allows for a thorough inspection for any potential signs and symptoms of disease. Over here we have honey. Bees store honey in the brood frame as a source of carbohydrates, so energy for them. Then we have some pollen here. Pollen is the bee's source of protein, lipids, vitamins and minerals. We have some brood over here with a few suspect cells to keep an eye on. Then we have some nice capped brood, and then we have some unsealed brood here. So now I've got the frame in the sunlight, I am looking for any kinds of sign of disease. For American foulbrood, this could mean a patchy, irregular brood pattern. The cappings could appear dark, sunken or greasy, and you may see perforations that are small, jagged and off-center. We're also looking for discoloured larvae, so we're looking for a change in that healthy pearly white to a coffee coloured brown and slumped in the cell. Another sign of American foulbrood is roping larvae. So this is when a matchstick is inserted into a suspect cell and infected larval remains may repeatedly rope out into a fine, sticky, elastic thread of up to 30 millimeters long. Another sign is pupal tongue. So this is where death has occurred during pupation and a partially developed pupal tongue may protrude up towards the top of the cell. So finally we have scale. This is a very advanced infection where dead larval remains dry to a dark brown hard scale that adheres tightly to the lower cell wall. Be sure to inspect a minimum of 3 frames of brood when performing inspections, and it is recommended to inspect your hives a minimum of 3 times a year, 3 months apart. It is also good practice to inspect brood frames for disease anytime equipment, frames, or materials are moved between hives. If you suspect disease, check out our next video, how to take a sample.